Burnout and emotional fatigue have plagued the healthcare industry for decades. One third of physicians and three-fourths of nurses are burnt out at any given moment. The COVID-19 pandemic has reminded us of the value of good nurses and doctors, but we've also witnessed how burnout at a large scale can ripple into hospital systems, causing staffing shortages and other major issues.
Unfortunately, hospital administrations aren't equipped to deal with these deeply personal issues, so burnout prevention is pretty much left up to the individuals. But current options are limited. Traditional therapy is inconvenient and relies heavily on finding a therapist one feels comfortable with. Other forms of psychiatric care often can't help with the profession-specific causes of mental health issues. This lack of resources for healthcare professionals has resulted in incredibly high rates of substance abuse, anxiety, depression, and suicide amongst doctors, nurses, and other healthcare professionals. Hi, I'm Rishika.
Hi, I'm Anuva.
Hi, I'm Aria.
And I'm the CFO.
I'm the CTO.
CEO of Heca. Heca is an AI-powered therapy software that allows healthcare providers to receive care and treatment for burnout, PTSD, and compassion fatigue before it starts to interfere with their work. Heca raises the level of customizability and accessibility of therapy while getting rid of the hassle and cost to the user. It gives healthcare providers the comfort of anonymity and provides hospitals an easy way to give their employees this much-needed service. When users open our app, the AI-powered chatbot will guide them through a series of curated, targeted questions. They will be able to answer using inbuilt text or voice support. The in-device AI is designed to then look for keywords in order to ask follow-up questions or give advice. This gives users a way to vent and make sure the stress and trauma from their job doesn't build up.
Thankfully, the artificial intelligence needed to power such a software already exists. And with a little extra research and development and compression techniques, we'll be able to get the AI on the user's phone, which is key to keeping data safe and ensuring anonymity, since it eliminates the need for a centralized cloud and makes sure that all data is briefly saved and then permanently deleted from all possible storages.
A key part of our mission is making sure the cost of this service doesn't fall on the user. Instead, hospitals and healthcare practices will purchase a monthly subscription, which is tiered in pricing based on the number of employees Heca will service. Each hospital will then, upon purchase, get a code to share with their employees. And the employees will then use that code to log into the app and receive treatment. This way, their information isn't aligned with an individual or their name. In addition to the other developments in machine learning technology, this will allow users to rest assured that their inputs remain completely confidential. In total, we estimate well over $130 million market potential in the United States itself. And once this app is developed, it is not that difficult to adapt this app to other hospital systems throughout the world or through other high-stress professions, including the police officers or EMTs, to be impacted through our app.
Heca takes from the latest psychology research to create an accessible, user-friendly, and cheap method of burnout prevention for our nation's healthcare workers. It gets rid of all the drawbacks of traditional therapy and builds on the ease and versatility of software development. Heca truly changes the game.
An apple a day keeps the doctor away. But what about the doctors themselves? Well, we have something better than apples for them. After all, according to a Becker's Hospital review, overworked healthcare providers may be linked to a 40% increase in risk of patient death. We want to ensure that everyone's health, including doctors, nurses, staff, and of course the patients, with our AI-powered stress-alleviating app, Heca. It's doctor's orders, but burnout, be gone.